When providing care to a resident with a new oxygen order, the CNA's first responsibility is to A. Adjust the flow rate to the level the CNA thinks is safe. B. Ensure tubing is positioned safely and not kinked. C. Change the humidifier bottle. D. Remove the oxygen cannula during meals. Answer: B. CNAs never adjust oxygen settings but must ensure tubing is safely placed, preventing tripping hazards and maintaining airflow. A resident suddenly refuses their morning medications, stating they taste poisoned. The CNA should A. Crush the medications and hide them in food. B. Encourage, then notify the nurse promptly. C. Ask another resident to convince them. D. Dispose of the medications. Answer: B. A refusal may indicate confusion, paranoia, or sudden illness, so the nurse must be alerted for assessment and documentation. When repositioning a bedbound resident with a stage 2 pressure injury, the CNA should A. Massage directly on the red area. B. Keep the resident on the injured side for comfort. C. Use pillows to offload pressure from the wound. D. Clean the wound before turning. Answer: C. Pressure relief is critical. CNAs must avoid massaging or applying pressure to compromised skin to prevent worsening. A resident with expressive aphasia becomes frustrated trying to speak. The best CNA response is A. Finish their sentences to save time. B. Tell them to speak slowly. C. Offer alternative communication tools. D. Ignore their attempts. Answer: C. Communication boards or gestures help express needs respectfully, reducing frustration and promoting dignity. Which action most reduces risk when feeding a resident with dysphagia? A. Offering thin liquids only. B. Encouraging the resident to talk while chewing. C. Keeping the resident upright during and after meals. D. Feeding rapidly to avoid fatigue. Answer: C. Upright positioning reduces aspiration risk and supports safer swallowing. If the CNA spills a small amount of a resident's blood on the floor, the first step is to A. Call housekeeping. B. Block the area and clean using facility PPE and disinfectant. C. Wipe with a dry towel. D. Ignore it if the spill is small. Answer: B. Blood spills require immediate containment and disinfection following infection control safety policies. A resident begins breathing rapidly with audible wheezing. The CNA should A. Give them water. B. Lay them flat and cover with blankets. C. Stay with them and notify the nurse immediately. D. Tell them to calm down. Answer: C. Respiratory distress is an emergency. The CNA must stay nearby and alert the nurse at once. If the CNA notices that a resident with dementia is repeatedly stuffing food into their mouth, the CNA should A. Restrain their hands. B. Allow them to continue to promote independence. C. Offer one bite at a time with calm verbal cues. D. Remove their tray immediately. Answer: C. Controlling pace prevents choking while preserving dignity and reducing agitation. When documenting a resident's condition, the CNA must A. Include personal opinions. B. Write only what the nurse requests. C. Record objective facts observed. D. Document in future tense. Answer: C. CNA documentation must reflect measurable, factual observations only, not assumptions or interpretations. A resident is on contact precautions. The CNA must remove gloves. A. After leaving the room. B. Before touching hallway surfaces. C. Only after talking to the nurse. D. When gloves appear visibly dirty. Answer: B. PPE must be removed before exiting to prevent contamination of clean areas. A resident who was usually alert is now unusually drowsy and difficult to arouse. The CNA's first action is to A. Offer coffee. B. Call their family. C. Report immediately to the nurse. D. Wait to recheck in 1 hour. Answer: C. Sudden mental status changes may indicate stroke, infection, or medication reaction and require urgent assessment. When assisting with morning care, the CNA notices a new skin tear. The CNA should A. Tape the skin flap back in place. B. Apply lotion. C. Cover it with a cloth and report to the nurse. D. Ignore it if small. Answer, C. CNAs must protect the area and promptly notify the nurse since skin injuries need evaluation. Before applying a gait belt, the CNA must always A. Place the belt over bare skin. B. Ensure the belt is loose enough to slip off. C. Check for any abdominal tubes or incisions. D. Position the resident in bed. Answer, C. A gait belt should never be placed over medical devices or healing areas to avoid harm. What action is appropriate when a resident with heart failure shows new swelling in both legs? A. Elevate legs and document only. B. Give extra fluids. C. Notify the nurse immediately. D. Ignore unless painful. Answer, C. New edema may indicate worsening heart failure and requires prompt clinical evaluation. A CNA is asked to witness a resident's legal signature. The CNA should A. Sign only if they explain the document. B. Decline and notify supervisor. C. Observe the signature without explaining the content. D. Sign even if the resident was confused. Answer, C. CNAs may witness signatures but cannot interpret legal or medical documents, they simply verify identity. During perineal care of a female resident, the correct cleaning direction is A. Back to front. B. Front to back. C. Circular motion. D. Side to side. Answer, B. Cleaning front to back prevents transferring bacteria from the anal area to the urinary tract. A resident says, I want to die today. The CNA should A. Tell them not to talk like that. B. Ignore the comment. C. Stay calm and report immediately to the nurse. D. Promise things will get better. Answer, C. Any expression of self-harm or hopelessness requires immediate escalation to licensed staff. When transferring a resident from bed to wheelchair, the wheelchair must be A. Facing away from the bed. B. Locked and positioned at a slight angle. C. Elevated to bed height. D. Placed at the foot of the bed. Answer, B. A locked wheelchair positioned at an angle creates a safe pivot path for transfer. A resident is coughing violently during a meal but can still talk. The CNA should A. Perform abdominal thrusts. B. Slap their back forcefully. C. Encourage them to continue coughing. D. Offer a drink immediately. Answer, C. If the resident can still speak, coughing is the most effective method to clear obstruction without intervention. While weighing a resident, the CNA must A. Weigh them with shoes on. B. Ensure scale is zeroed before use. C. Guess the weight if numbers fluctuate. D. Record weight in pounds only. Answer, B. A zeroed scale ensures accuracy, critical for medication, nutrition, and diagnosis monitoring. A resident wakes up confused and tries to wander out of the facility. The CNA should A. Block the exit physically. B. Redirect them calmly to a safe activity. C. Lock them in a room. D. Call security only. Answer, B. Redirection prevents distress and maintains safety without using force or restraints. When assisting a resident with a prosthetic limb, the CNA should A. Store the limb anywhere it fits. B. Apply it even if it causes pain. C. Inspect the skin before applying. D. Use lotion before attaching. Answer, C. Skin must be checked to avoid pressure sores, irritation, or other complications under the device. Before performing range of motion exercises, the CNA must A. Ask the resident their goal for the day. B. Warm the joints with hot towels. C. Confirm the nurse's orders. D. Push joints to their limit. Answer, C. ROM requires specific instructions to avoid overexertion or injury. A resident's dentures fall onto the floor. The CNA should A. Rinse with hot water. B. Clean and disinfect per facility policy. C. Place them back immediately. D. Use bleach. Answer, B. Proper disinfection prevents infection while protecting denture material integrity. A resident on fluid restriction requests extra water. The CNA should A. Provide a small amount secretly. B. Refuse without explanation. C. Explain the restriction and notify the nurse. D. Replace water with juice. Answer, C. Education and communication ensure safety and proper adherence to medical orders. A resident with advanced Parkinson's disease needs feeding assistance. The CNA should A. Feed quickly before tremors worsen. B. Use adaptive utensils and pace slowly. C. Stand behind the resident while feeding. D. Thicken all foods without orders. Answer, B. Adaptive utensils and slow pacing promote dignity and safe swallowing. If a CNA notices a medication left on a resident's bedside table, the CNA should A. Dispose of it. B. Give it to the resident. C. Report it to the nurse immediately. D. Put it back in the medication cart. Answer, C. CNAs cannot handle or administer medications. Unsafe medication placement must be reported. When assisting a resident who becomes dizzy during ambulation, the CNA should A. Continue walking. B. Pull them forward. C. Lower them gently to the nearest safe surface. D. Leave to get help. Answer, C. Controlled lowering prevents injury while the CNA stays with the resident. Which task is always outside a CNA's scope? A. Reporting a resident's complaint. B. Performing sterile wound care. C. Measuring temperature. D. Assisting with grooming. Answer, B. Sterile procedures are restricted to licensed nurses. CNAs cannot perform them. When a resident has hemiplegia, the CNA should dress A. Weak side first. B. Strong side first. C. Whichever is quicker. D. Weak and strong sides at the same time. Answer, A. Dressing the weak side first reduces pain and makes the process safer and easier. A newly admitted resident is Muslim. The CNA should first A. Remove all pork products from meals. B. Ask about personal religious preferences. C. Assume their practices. D. Schedule daily prayer times. Answer, B. Cultural needs vary. Asking respectfully ensures accurate and individualized care. If the CNA finds a resident sitting on the floor uninjured, the CNA must first A. Lift them up quickly. B. Ask why they fell. C. Stay with them and call the nurse. D. Move them to bed immediately. Answer, C. The nurse must assess before moving the resident to avoid worsening possible hidden injuries. When performing hand hygiene, friction should last at least A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 3 minutes. Answer, C. Rubbing for a minimum of 20 seconds ensures removal of harmful microorganisms. During a fire drill, the CNA's priority is to A. Run toward the fire to investigate. B. Save documents. C. Move residents away from danger following race protocol. D. Open all windows. Answer, C. Race, rescue, alarm, contain, extinguish, guide safe evacuation and response. If a resident complains of chest pain during a bath, the CNA should A. Continue washing to finish quickly. B. Sit them up and alert the nurse. C. Lay them flat and leave. D. Offer water. Answer, B. Chest pain can signal cardiac emergency. Immediate nurse notification is vital. A resident with a Foley catheter reports discomfort. The CNA should A. Adjust the catheter position internally. B. Pull the tubing. C. Ensure the tubing is not kinked and notify the nurse. D. Remove the catheter. Answer, C. CNAs do not insert or remove catheters, but they ensure proper tubing placement and report concerns. A resident receiving hospice care asks if they are dying. The CNA should A. Provide false reassurance. B. Avoid the question. C. Listen empathetically and notify the nurse. D. Tell them they have months left. Answer, C. Emotional support and accurate escalation ensure compassionate, appropriate care. When collecting a urine specimen, the CNA must A. Use any container available. B. Keep the sample warm. C. Label the container before leaving the resident. D. Place the sample on the floor temporarily. Answer, C. Proper labeling at the bedside prevents mix-ups and ensures accurate testing. Which action most helps maintain resident confidentiality? A. Discussing cases in the hallway. B. Leaving charts open. C. Closing the curtain when providing care. D. Talking loudly about care tasks. Answer, C. Privacy measures protect resident dignity and ensure HIPAA-compliant care. When assisting a resident to stand, the CNA should A. Pull the resident up forcefully. B. Bend at the waist to lift. C. Use legs for strength and maintain proper body mechanics. D. Twist while lifting. Answer, C. Safe body mechanics prevent injuries to both resident and staff during transfers.